The anti-obesity bias greatly impacts the patient's psychological well-being. Look, we, both healthcare professionals and everyone else, since childhood we hear about the negative aspects of obesity. So this is something that's ingrained in our minds from the start. So, what is anti-obesity bias? Anti-obesity bias is placing the blame for obesity on the patient themselves. So the patient seeks help for some symptom. And the moment you diagnose obesity, you place that blame on the patient. You're obese because it's your fault, and not because of a disease. This alone is already a problem for someone who is truly obese. But it's a much bigger problem for the patient who isn't obese, the patient who has lipedema. So she gets the obesity diagnosis, she receives the blame for this diagnosis, and at some point in her life she discovers that it wasn't obesity and she didn't deserve all the blame that was placed on her. And this is very common among all healthcare professionals. So you might end up seeking help for a leg pain or for anything else. And everything will be attributed to obesity. And you're asked to lose weight. So the blame is yours, the obesity is yours, you have to lose weight. But without the tools to lose weight, you end up not succeeding. For someone who is obese, it's already hard. Imagine for someone treating obesity, but it's actually lipedema. You don't have those tools, and you end up blaming yourself. And this generates a feeling of helplessness. You can't solve your problem. That's why early diagnosis of lipedema is so important, and the distinction between these two diagnoses, obesity and lipedema. And it would be very commendable for all health professionals to fight against this anti-obesity bias.